Finally, we would like to answer some questions that you sent us in advance. The first question is, we have a product for which a material master record exists and we sell them in different quantities. 1 piece, 5 pieces and 10 pieces. Each of these packages has its own GTIN. Do we need to create a basic UDI and 3 UDIs at UDAMED?
This is a very interesting question that is actually asked very often. If the product is only sold in different quantities, then this can be represented using the packaging hierarchy. This means we have a material master and 3 different packaging sizes with 1, 5 and 10 pieces. This would then be reflected as 1 basic UDI and only 1 associated UDI-DI. In the UDI-DI, you only maintain the single piece. Since we also have to specify the quantities in the UDI-DI, including the packaging quantity, the quantity of device would be entered as 1. The other 2 quantities, 5 and 10, would have to be entered in the packaging table. This way you would have maintained all the data correctly. A variation of this question would be, if the smallest sales quantity would be greater than 1, let's say there would be a 10, 50 and 100 packaging, then everything would actually be answered the same way with the difference of the quantity of the devices of the smallest packaging size would be equal to 10, and we would have to enter the unit of use DI. This unit of use DI would be a virtual DI number in accordance with the agency standard you have chosen, which would only be used if one day you decide to sell the product in a single package.
The second question is, who is to be named as the manufacturer in UDAMED if our products are produced outsourced but we carry out the technical documentation and sell the product under our brand name?
According to MDR, you are considered as a manufacturer if you produce a product, refurbish it, develop it yourself or have it developed or refurbished, and then market this product under your own brand name. Accordingly, you are to be named as manufacturer since you appear on the market as the manufacturer by marketing the product under your name. This also applies if you don't produce your product yourself, but you have it produced. In addition, you carry out the technical documentation and therefore you appear on the label of the product, which further underlines your role.
And the last question is, we are manufacturers of dental products which are smaller than 1 cm on average. Do we also have to directly mark the UDI on our products despite the limited product size? Are there any exceptions?
Generally, all reusable medical devices must be marked directly. For this purpose, the UDI has to be in a plain text version, which consists of characters, also known as HRI, Human Readable Interpretation, as well as in a barcode, which is usually a data matrix. The data matrix is chosen because it has a very small dimensions comparing to the one-dimensional barcodes. Exceptions would be if there is any significant limitation, for example due to too small product sizes or due to the radius, the curvature of the product, or if this affects any damage on the material or causes corrosion. We have now reached the end of our webinar. We hope that we have been able to help you understanding the UDI requirements and the technical requirements better. We will send the link to this video to all participants who have registered by mail so that you are able to re-watch it. We wish you all a good time and much success in implementing the UDI requirements in your company. Thank you all and bye bye.